Of course, the definitive way to make the diagnosis of diabetes is to have, as it sounds like you've had, the glucose tolerance test, and then to measure the blood sugar level after drinking a glucose solution. It sounds like your blood sugar level is not elevated. But what we know is that some people who are destined to develop diabetes actually get hypoglycemic at the end of the glucose tolerance test. So during the first 2 hours, which is the standard glucose tolerance test, the glucose values may be normal. But 3 to 4 hours after ingesting the glucose, it's not uncommon for people who are destined to develop diabetes to have a low blood sugar level. And some of the symptoms that you're having after eating sound like you may be having a low blood sugar level. So in this case, what we might do is to bring you in to repeat the oral glucose tolerance test, but to extend the test for upwards of 4 hours to see if your blood sugar level drops to a low level. So here's a somewhat unusual and paradoxical situation where a low blood sugar level actually can predict who's going to get diabetes later in life. The other thing that we can do in your situation would be to also measure the insulin levels during the glucose tolerance test. So if you had very, very high insulin levels, that suggests that the tissues in the body are resistant to insulin, and in fact you might actually be predisposed to develop diabetes. And because you have very high insulin levels, 3 to 4 hours after you eat the meal, these high insulin levels are causing your blood sugar level to drop to a low level. So this might be why you feel sort of woozy and sick and weak after eating your meals.